Hello everybody, happy Friday. Welcome to Fun Fact Friday. Dr. Alfred Marcus at Marcus Integrative Dental. So, we are doing a video, but before we get started, I have with me Natalie, who's been with me for how many years, Natalie?
28.
I'm sorry?
28.
Oh man, 28 years. I think you were just starting to walk when you came in, right? Yeah. So anyway, Natalie's been with us for 28 years. I'm grateful that she's here. She's up in front. She'll be one of the people that will welcome you when you come to our practice. Just real quick, forget that there's a camera in front of you, Natalie. What's one thing you would say is a common comment that we get? What is it that patients appreciate about us? Just what comes to mind right away?
Probably the care, patient care. I mean, the way you explain treatment. Well, there's a lot. I just can't say one, but...
Natalie, you're making me blush. But anyway, if you are in need of a dentist, here we are. Give us a holler here at Marcus Integrative Dental. Thank you, Matt.
Thank you.
Go back to work. So, Fun Fact Friday. My topic today is part 2 of sugar. It's not as sweet as you think it is. So this is part 2. I'm going to go over part 1, just a couple of high facts. First of all, if you were listening, I mentioned that the U.S. Department of Agriculture says that the average American consumes between 140 to 170 pounds of sugar. That would be roughly 30 to 34 5-pound bags of sugar that's consumed by every American here in the United States of America. That equates to about 2.5 pounds every month, probably a little more. And what I also point out is that 74% of packaged processed food has sugar added to it. And we're not just talking a little bit of sugar, we're talking a lot of sugar. I mentioned, for example, that Frosted Flakes, for example, the number 1 ingredient in Frosted Flakes is sugar. Number 1, more than anything else, is sugar. No wonder it tastes so good. So this isn't just about tooth decay, but what we're seeing is obesity rates from 2021 was showing that 41% of adults are obese. Actually, I think it was of Americans are obese. It was including everyone. 41%. And that will affect heart disease. It affects diabetes. There's cancers. It even affects brain function. It tends to cause poor brain function where, maybe even depression and things of that nature. In the past 3 decades, obesity rates have doubled. And type 2 diabetes, which is related to sugar intake, maybe, there's other things, but diabetes has tripled. So when we start reading labels, we have to look at what is in the foods that we buy. So they don't just put sugar. There's a lot of different words. I have to read this because I can't remember them all, so I'm just going to rattle off. If you see these different things, understand it's sugar. There's maltose, there's malt sugar, there's dextrose, there's beet sugar, there's crystallized fructose corn sugar, there's sucrose organic sugar, agave syrup, malt syrup, corn syrup, brown rice syrup, palm sugar, coconut blossom nectar, evaporated cane juice. It's all sugar. So be aware of what you see on the labels and start to pay attention to that. Hey, wait a minute, this is supposed to be Fun Fact Friday. Sounds like a bunch of gloom, but in actuality, I have some tips that maybe are going to help you along. So, moderation is key. We always hear about moderation. So really, how much sugar can you consume in a day? It's recommended 6 to 9 teaspoons a day. 6 to 9 teaspoons, which will be roughly about 25 to 35 grams. And we're talking teaspoons, not tablespoons. I've seen people that do 6 to 9 teaspoons in just 1 cup of coffee. So you want to watch it. Now there are some safer sweeteners, substitute sweeteners that you can use, but there again, you've got to be careful. The number one artificial sweetener is aspartame. Aspartame is pretty interesting. It was pretty interesting when it was approved by the FDA. Prior to their approval, it had gone years and years being disapproved because of the results of the studies. But after a lot of negotiating and back and forth, all of a sudden it was approved. Right or wrong, it's an artificial sweetener, and it's probably the number one artificial sweetener that's on the market today. Interestingly, aspartame, when it's broken down, is broken down, and one of the byproducts is formaldehyde. And it's in your body, formaldehyde. What if I give you a few drops of formaldehyde? Are you going to be happy? Probably not, but it is one of the byproducts when it is broken down. I wonder if that's healthy for us or not. I'm not going to say it is or isn't, but you decide on that. There's other artificial sweeteners that probably could be equally bad for you. There's another artificial sweetener called sucralose. Comes in the yellow package, and it's interesting how it was discovered. In actuality, scientists were trying to come up with an insecticide. One of the scientists that was working on the formulation accidentally touched what he had produced and touched his mouth, and he goes, "Oh my goodness, this is sweet. Maybe we made an artificial sweetener." That's pretty interesting. A little accident, and it makes me wonder, should I be concerned or not? So, I also hear about glucose as a sweetener versus fructose as a sweetener. Well, fructose is broken down by the liver, and it has been implicated in the production of fat and the production of fatty liver. And if you read the labels, fructose is the most common sweetener that's used in everything from sodas to processed foods. So we got to be careful with that. Now, glucose as a sweetener is probably not going to be toxifying to you. However, it can be directly absorbed by every cell in the body. That's pretty cool. There aren't any real side effects, but it will raise your carb intake, which affects the storage of fat, and again, will affect things like diabetes. So what could be options? Well, one of the options might be stevia. Stevia comes from a plant. It's used quite a bit in Japan, and it really at this point doesn't have any side effects. There's also xylitol Xylitol is another natural sweetener. It's a type of alcohol. No, you're not going to get drunk eating it, but that might be an option. You know, read up, see if it's something that might work for you. But the best thing is to try to reduce your sugar intake. There is such a thing as sugar craving, and one of the things that is implicated is disbalance in the gut flora, what we call the biofilm, the bacteria that actually coexists and lives and is critical to our health. It actually can change over time and make you crave sugar. As you start eating more sugar, you in essence become addicted. You in essence become hooked on it. I'm wondering if maybe that's what the food industry would like for us to be craving their foods. I don't know. I'm just saying. So look at the gut. Look at gut flora. Read up on that. I might do a video on that here sometime soon, but it's really an important part of our whole existence of our body. There's an author, his name is Dr. Robert Lustig. He has a book, A Case Against Sugar. He goes into this. He actually is a leading expert on the different sugars and how they affect us. He's an endocrinologist with specialty in pediatrics, but he comes up with a lot of good information if you want to dive into it. So, in summary, if you're struggling with excess weight or chronic disease, one of the foundational treatments, strategies that you can come up with is embrace eating real food, not processed food. We need more real food. We really don't need more medications. I'm Dr. Alfred Marquez. I hope this was informational. Please feel free to follow us on our website, marquezdental.com, our Facebook, like us, Instagram, what else? YouTube, we have a YouTube channel, just a lot of stuff out there. So feel free to follow us. Dr. Alfred Marquez, thank you.